Welcome to another inspiring episode of HerCast with Dr. Chito. Today, we're thrilled to explore a topic that touches every woman's heart: glow through the ages, skincare from breakouts to wrinkles. Our skin is a canvas that evolves with us, telling the story of our lives from the trials of teenage breakouts to the beauty of mature skin. But navigating this journey can be challenging, and that's why we're here to share insights and empower each other. Joining us is the amazing Dr. Hilda Ashio Titiloye, a true pioneer in the field of skincare. As the founder and CEO of UNNO Health Group, of which Skin 101, I know you guys know that, it's Clinics Limited here in Abuja and Lagos, Skintivity Skincare Limited, and Ashley Medical Services are subsidiaries. Dr. Hilda brings over a decade of expertise in aesthetic medicine, with advanced training from prestigious institutions like Queen Mary University of London and the University of Cordoba in Spain. She's not just a licensed practitioner dermatologist, but a leader shaping the future of skin care. Today, we delve into practical tips and strategies to nurture our skin through every phase of life, embracing the breakouts, celebrating our uniqueness, and gracefully aging. Whether you're seeking solutions for acne or looking to enhance your skincare routine as you age, Dr. Hilda will guide us every step of the way. All right, so let's start and embark on this radiant journey celebrating the glow through the ages right here on HerCast. Welcome, Dr. Hilda.
Thank you. I'm thrilled to be here. Thank you.
And I wanted to also mention that Skintivity is where you manufacture your brand here in Nigeria.
Yes.
So, I mean, you're doing great things in Nigeria. And I think people need to know that. This is awesome.
Thank you.
All right. So I want to kick off with my questions, and it's going to be a conversation because I, of course, have questions about my skin as well. So I know I'm a gynecologist, so I know you're not surprised my first question. And you can modify this as any way you want. But how do hormone changes, right? Because everybody talks about hormone changes, like during puberty, affect skin and cause acne. How does that happen, this acne and hormones?
Okay. Thank you for having me again.
Sure.
I'm thrilled to be here. So from puberty, we all know that there is a surge in mostly the androgens, right? Testosterone, and both in males and females, and also a surge in estrogen for females. So the changes that we see that happen in puberty are an increase in the size of sebaceous glands. So your sebaceous glands produce sebum, which is natural moisturization for your skin. Once we get to puberty, those glands become more robust, produce more of that sebum. The sebum serves as a breeding ground for bacteria to thrive a bit more. There's a production of a certain type of cell within the duct that takes the sebum out of the gland onto the surface of the skin. All of those things culminate into the production or the eruption of acne, what we call pubertal acne. So that's why you find teenagers. We normally consider acne to be a condition of teenage boys.
Yes.
But we find that the girls seek more help for the problem. So that's what happens in puberty. So all you need to do really is, basics, salicylic acid wash, benzoyl peroxide wash, things like that. Things that will reduce the production of sebum, will increase the turnover of the skin cells. Antibacterial topical products, they do just well for that stage of life. Moving on to early adulthood, for many people, once they get into their early 20s, the hormones settle and they stop having the acne. Some people might carry that problem into early adulthood, where the hormones still continue to cause the acne or trigger the acne. For females, they might notice that with the change in the menstrual cycle, they still have those eruptions. But once they start getting to late 20s, for many people, not all now,
Yeah.
the acne stops or it reduces. For females, it's a bit more peculiar because we have the use of contraceptives, we start to have children, so pregnancy and all of those changes that happen with the hormones at those stages of life also can have an impact on the skin, mainly via the same acne. Hyperpigmentation also. So hyperpigmentation is just an increase in the amount of pigments.
So like the darker patches of skin? Okay.
Yes. So as we get a bit older, we get into early adulthood, middle adulthood, even before we start getting to menopause, that could be a challenge. Having patchy skin, especially if, you're in this part of the world and you don't do much about sun protection, or you don't use sun protection. That could be a problem. Then going into menopause now, from maybe early 40s, some people said as early as early 40s, down to your 50s, you have a reduction or a decrease in the amount of estrogen that is being produced. The skin becomes drier. Because estrogen, remember, it contributed to the oiliness that you had when you were younger. Estrogen gets, the skin becomes drier. Of course, it's the elasticity that you normally see with younger skin starts to dwindle. All as a function of estrogen. And the skin becomes thinner. And more easily sensitized. So products that you could tolerate when you were younger, you just find that, why is this product stinging? Or why, do I use a new product and I have to contend with a bit of stinging, excessive dryness and all that for a bit before it settles. For some, it might not even settle at all. Because the skin just refuses to tolerate the product. So that's what happens with the hormones. Through the stages of life in relation to the skin.
You mentioned something about protecting from the sun, and I noticed that, I find that a lot of, especially in Nigeria, where Black people, let me put it that way, don't feel the need always to know that, you need to also protect, yourself from the sun. I guess from the beginning, they always say if you have more melanin, there's more protection. But I think you should say a bit about how important it is, even from childhood upwards, to protect the skin from the sun. And when it comes to SPF, and how do we choose what's best for our skin?
So, for skin of color, which would be all of us here, skin type 3, we use something called the Fitzpatrick skin type to do that typing. Skin type 3, 4, 5 starts from your Asians, Hispanics, your Indians, all of those skins, down to your African skin. So what we say happens with that type of skin that makes it skin of color is that when we go into the sun, we hardly burn. We will tan faster than we will burn. Not that we don't burn at all. It's possible to burn, but the likelihood of tanning is higher. In the lighter skin types, so your Caucasian skin types, they would, when they go into the sun, they will more likely burn than tan. So that's the difference in the skin types. Now, what melanin does is that it provides, so when they say black doesn't crack, it cracks, but later.
Black doesn't crack. I like that.
But later. And if it has gotten really good care, you can push later till much later. So what happens is we have melanin. Melanin serves as a natural skin sun filter. And it said that it provides up to an SPF 10 to 15. Depending on the density of melanin. But what happens there is, when I go into the sun, for example, and I come in contact with my UVA, UVB rays. So the rays come into the skin. There is a level of the skin, the base of the epidermis. That's where you have your melanin, your melanocytes and your melanin being produced at. When, as a person of color, when the sun gets to that part of the skin, I produce enough melanin to ward it off.
Yes.
To some degree. But what will now happen is that production of melanin shows on the surface of the skin as hyperpigmentation.
Okay.
Which could now be patchy or could be too much. Right?
Yes.
That's why you have people saying the areas that are exposed to the sun, their faces, their arms, their legs, are darker than the rest of the body.
Yes.
So that's what happens. By having this melanin ward off the sun rays, you don't have the rays, or you don't have as much rays getting to the dermis, which is where you have collagen, elastin, and those are responsible for the integrity. You know, the bounciness, of your suppleness, the tautness of the skin.
Yes.
And that's why we don't wrinkle as fast.
Yes.
So, to reduce, you can still have the best of both worlds.
Yes.
Where you're having your melanin providing that protection, but you are also helping it by adding on the sun protection.
Okay, yes.
So that you are not having the sun rays go to that level where they are destroying your ability to maintain the integrity and the structural framework
of your skin.
So that's what happens.
So very much you want to have your skin as clear as possible.
Yes.
You must use sun protection then.
So what we normally recommend, so we find that a lot of people with skin of color, they use the sun protection more for the cosmetic benefits.
Yes.
Rather than the anti-cancer benefits and all of that.
I don't think anybody thinks about the anti-cancer part. There's like, you said hyperpigmentation, that's all I need to know. Yes.
But, so if you do the cosmetic, what I tell patients is, if you're after the cosmetic benefit, it's fine. It will still protect you from the
anti-cancer part. Yes.
So, for cosmetic benefits, we try to use at least an SPF 30. And it should be tinted.
Okay.
At least an SPF 30 and it should be tinted. Because there's something still called visible light. So the light from your LEDs, your phone and all of that, it can have an impact. For us, it can trigger the same hyperpigmentation.
Oh, wow. Okay.
So we try to use at least an SPF 30 that is tinted. And we should reapply. The ideal thing is that we should reapply sun protection every 2 to 3 hours.
But by the time you do the sun protection, then you put your makeup on. How are you going to reapply the sun?
So there are preparations now that are available. Sprays.
Okay, like sprays that won't affect your makeup.
Yes. Well, they would affect the makeup, but they'll allow you at least to still have the makeup on. We don't have those solutions at the clinic because the jury is still out on how much protection they provide.
Okay.
There are sprays, because some come in powder form, you know, where you could dab. They say it provides some protection, but I have not explored that, to be honest. So I don't even recommend it.
Just the normal
as much
sunscreen.
As possible, especially when you know you'll be outdoors a lot. Just reapply your sun protection, your proper sun protection, be it in lotion form, in spray form, in creamy form. Apply it every 2 to 3 hours, and many times you'll be fine. So some patients will say, but I'm always indoors.
Avoid the sun.
I'm always
I was
about
to say it now, just avoid the sun.
So your rays coming through the windows.
True.
Except if you live in a dungeon-like situation where all of your light is artificial light. But remember I said you also still have rays coming from your LEDs and your phones and all of that.
Yeah.
So you might not be having as much exposure to rays that would cause this hyperpigmentation we're talking about, but you would still have some. So that's the summby of regarding sun protection. And
I must say I'm bad at it then, because I do not do every 2 to 3 hours. That's for sure. I don't do it at all.
It's not
from the morning,
easy,
and that's it. Yes,
it's doable. Not easy, but it's
doable.
If
this is black doesn't crack. But if you want you not to crack earlier than others, then this is part of what you should do. That's the important part. Now, there's something that one of the things I always talk about when I'm talking to pregnant women, and they don't hear much about. And I think some of these things are available just over the counter, retinoid A products. I feel they go into different stores and just get it and don't realize, and it's not only for pregnant people, but people that are actually trying to get pregnant or planning to get pregnant, and they're on this retinoid, which is a very effective treatment for acne. But many people don't know, and this sold in Nigeria, sold just over the counter without any counseling. Nobody says anything, and they come in and they're already pregnant on retinoid. What's your take on this, and how pregnant women should avoid this, and maybe other things that they should avoid? Because this is something people don't talk much about.
Yes. So for retinoids, especially because we have a poor regulatory environment.
True.
Context is important. Because if you look at the area of the face where you're using the retinoid on, it is not a large area.
Okay.
But because you will not have the opportunity to tell this pregnant woman to ask this one if she's using it on just her face and ask the other one where she's using it at. I just tell my patients not to use, because they buy tretinoin, which is one of the strongest retinoids. They buy it over the counter in Nigeria.
Yes.
And I've had patients come in, they squeeze this tretinoin into their body creams.
Wow.
Because it has a very nice exfoliative property. It's when you're managing hyperpigmentation, it helps your products work faster as well because of the peeling it can cause, and it helps smoothen the texture of the skin as well. It helps with stretch marks, all of that. So you have patients that squeeze these products into their creams. So if you look at the surface area they're applying the products on,
it's a lot.
It's a lot. And like I said, because I'll not have the opportunity to tell this person versus the next person where to use and where not to use.
True.
We just tell them not to use the retinoids during pregnancy.
Yeah. Or when you're planning, because I
always
tell people, the very first 4 weeks of when you conceive is the time that the damage is done the most. And you wouldn't know because you wouldn't have missed your period by then. So I always tell them the retinoid you buy over the counter, always ask and see whether you should take it or not. But you're right. I know here is this. One thing I've noticed is someone says this works for me. Nobody asks questions. Everybody, your friends, everybody will start using the same thing, the same way, and nobody asks anything.
And because they can get it over the counter.
If
there was room for us to see everyone that was going to start a retinoid, then we can see, okay, you can use it in this way. If you're using it on these areas, that we can, but you don't have that opportunity for most people. We even have the oral retinoids. People buy them over the counter.
Oh my goodness.
Oh yes.
Without the counseling I know sometimes, I don't know if it's a law or it's a regulation, but a rule, but I know that there was always the teaching that if anybody's on retinoid, in like a young person on retinoid, should be on some kind of family planning until they finish their treatment.
Very well.
Before, trying to get pregnant, they should be off retinoid. So I don't know if people should actually hear that from this, I guess.
So we don't, for the topical retinoids, we don't do all of the family planning and all that.
Yes.
But
the
for
oral, yes.
Yes. For our clinic, you have to do a pregnancy test.
Yes.
You have to run liver function tests, basic tests, so we know what's happening before we even start you on the oral medication. Then ideally, a lot of people will say they're not sexually active. Will free you. But if you're sexually active, you must be on some form of family planning.
And not one that now counteracts the effect of the...
Yes. Yes. So, yes, that's how it works.
Okay. Now, what will you consider an effective, simple skincare routine? Like when you say, like I just told you, I just wash my face at night and go to bed, to be honest. And I know someone says, you don't need to it's better to not use your hand, use a sponge or a face towel, but what would you consider, so what would be my skincare routine, the most effective skincare routine that could preserve my skin.
Is that you or?
Well, I think I'm talking on behalf of people like us that have
through the ages.
Through the ages. Okay, let's say because me, I've entered the other part of the age. But let's talk about, let's say, through the ages. So let's even talk about teens to 20s, 30s, 40s, 50s. Yes. What will be an effective skincare routine?
Okay. So I will start from, because of social media.
Yes.
I have patients as young as 12, 13 coming into the clinic to ask for a skincare regimen. And I'm like, you just need a basic wash, a hydrating wash maybe, and a basic moisturizer.
Yeah.
Basic at that age.
Yes.
Once you start getting into puberty, yes, you're having breakouts now, then we can look at regimens that would include maybe a salicylic acid wash, because that will help to exfoliate. You know, I told you there were some cells that are being excessively produced at some level of the skin. Salicylic acid wash will help with that. It helps to unclog the pores, reduce the oiliness. A benzoyl peroxide wash, I like to combine both.
Okay.
For most of my young clients.
Okay.
Because it's more difficult to get especially your male teenagers to use one product, apply another one, apply another one. So many times I'll just do salicylic wash in the morning, a benzoyl peroxide wash in the evening.
Okay.
Then a moisturizer that maybe has azelaic acid or, one of those other, because for skin of color, when we have acne, because of the inflammatory process, we'll have post-inflammatory hyperpigmentation.
Okay.
So as part of managing the acne, we have to actively manage the spots, the hyperpigmentation, the black spots that come up. That have come up from the acne. So yes, basic moisturizer, maybe azelaic acid, kojic acid, basic. That would help with the hyperpigmentation. Then, of course, sun protection. So when you're managing any form of hyperpigmentation, be it localized, generalized, in a spotty form, and from what I described, once you go into the sun, the sun makes that spot darker.
Yes.
So you want to also use sun protection to help the spots clear out faster. So that's really what I do for my teenage patients and those in early adulthood that have acne. I add on retinoids as well.
Okay.
So if I see the person is quite motivated, I add on a retinoid. They use the retinoid at night. It helps increase cell turnover, and it also helps with the hyperpigmentation that comes up from the acne. Then moving into your 20s, 30s, for every patient from 20, once we're not managing you for acne. From 20 down to 50, 60, I add on vitamin C in the morning.
Okay.
So vitamin C
ointment?
Vitamin C, I like it in serum form.
Serum, okay.
Because it's easier to layer with, maybe your moisturizer or your sun protection. So I add on vitamin C in the morning. Vitamin C will give you such good benefits.
Okay.
It's an antioxidant. It helps with hyperpigmentation. It helps with the production of collagen, elastin. So, and this very nice glossy look that people call a glow, it contributes to giving that.
Wow.
So for almost everyone, I put a vitamin C in the morning, and it helps the sun protection work better.
Okay.
Because of the antioxidant effect that it has. So you wash with, if you don't have much problems, you can wash with a bland moisturizer. So by bland, I mean it doesn't have active xylates and all of that. Just hydrated. Maybe it has glycerin, hyaluronic acid, ceramides, bland. If you don't have much issues. This will be for people in their earlier, maybe 20s and down to maybe their late 20s. So we have, normally, your skin sheds itself.
Okay.
That's why, the way the snake sheds itself, our skin does that, but it's not as visible as that of the snake. That's why no matter how much you wash your skin, when you use your towel, you still see something. That's not dirt. for many people, that's not that's your skin that is
shedding
itself.
Okay.
So, and that shedding process happens every month for younger skin.
Does it get less or more?
So that in that process increases the number of days as you get older.
Oh, wow.
So it's said that when you're in your 20s, your skin renews itself every month or every 30 days. By the time you're getting to 40, it increases to 40 days.
Wow.
So that's why your skin might also look duller as you get older. So once you start getting to your late 30s, your late 20s, to your 30s, 40s, I add on an exfoliant.
Okay.
So it might be mandelic acid. If you also have oily skin, I could add on a salicylic acid, could be an azelaic acid. So it depends on the needs of the specific skin. But these are the principles that guide how we choose the skincare products. A wash. Remember your vitamin C in the morning, your sun protection in the morning.
Yes.
Then at night, from your 20s as well, late 20s, early 30s, I try to add on a retinoid.
Okay.
So depending on the needs of the skin, it will guide me in choosing the strength of the retinoid as well. And that's really it. When you get to more mature skin, I call it mature skin. I don't call it older skin.
No, it's not older.
More mature skin.
Matured is good.
In your 50s and the like.
Yes.
You would need... That's why you have heavier moisturizers for night use for more mature skin. Because you need more moisture. Recall I told you that the skin is drier as you get to that age. So you now need moisturizers that have ceramides, peptides, a bit heavier than what you need in your younger, than what you needed in your younger days.
Yes.
Let me also add that for people that were frustrated in their teenage years because they had acne, the skin was so oily, it was so thick, they would enjoy that skin when they start getting older.
That's what I'm saying. I have oily skin, and I think that's why I enjoy my skin now. I have oily skin.
When the rest of us are crying about
I hated my oily skin growing up though.
So, but you will love it
so
now.
much. But now I think it's
because with the slight dip in estrogen, that kind of balances itself out. The oiliness reduces a bit, and you might not need as much moisturization as, your counterparts that didn't have that thick, oily skin. But then remember that...
So those that have dry skin are worse off, much more...
Well, they would have this problem with dryness. They will experience it more.
Yes.
So
they will need to make more attention to their skin.
More of an effort to
moisturize their skin.
To fix that. I like to say that there is no skin that is bad skin.
Yes.
You just need to meet the needs of your own skin. If you have oily skin, use products that are tailored to that type of skin. If you have drier skin, use products that are tailored to that type of skin, and you'll be fine. So
it means I've not been having a really good skincare. Just wash my face and go to bed. Oh boy. One of the back and forth you see between dermatologists and gynecologists is on really the effect of hormones. Because you see a lot of patients come in and say to me, like, oh, my face, I don't want to break out. I heard hormones do this and hormones do that. What is the balance? Because sometimes there are some conditions we have no choice but say, the only thing that can help you here is a hormonal treatment. And so what would you suggest from the dermatology point of view will be that balance for people? And I always try to tell them it's not everybody that reacts to these hormones. Some people have it and nothing changes at all. Some people have it and will affect them. We will have birth control pills that make your face even smoother, according to one particular one that was what they advertised. That was how they marketed their birth control pill, that your face would get smoother. But what's your take? Because I know when they come to you, they say the same thing, like, okay, should I stop this or should I stop that? What is usually your take to your patients or clients when it concerns hormones and hormonal treatments, whether as a teenager, whatever, but whatever it is, and skincare?
So some things are absolutely necessary. That's what I tell the patients. If it's a condition that requires that you fix, we will prioritize that over the skin. Yes. We can always fix the skin.
Yes.
When this other thing is resolved, is taken care of. If you have polycystic ovaries and well, many times when we fix the polycystic ovaries, the
skin gets better.
The skin gets better. But for many other conditions where the quality of life is really affecting your ability to function, we won't prioritize your skin over that.
I mean, they do. You won't, but they they're like, my skin, the skin, because I'm always battling with the skin in my office. I'm always trying to,
find a balance
between their skin and my
balance comes around prioritizing what is health, because I can't afford for you to be fixing skin and making you more prone to stroke.
It's true. It's true.
You know, it's not a trade-off.
Yes.
That makes sense. So I tell them these things in those terms, and many times I think they understand. Okay. So also showing empathy and trying to be on the journey with them.
It's true.
I think
that's true. That
helps them accept it better.
How do you feel social media? Okay, so a lot of times and maybe this is younger clients, but a lot of times social media has influenced a lot of areas, especially when it comes to aesthetics. And how do you feel that affects your ability to actually put care plans for your patients or get them on the right skincare? Because everybody's looking at social media, and how has that affected your practice of taking care of people and their skin issues?
Social media. Double-edged sword. On one end, what it has done is spread, the people are now aware that there are professionals that actually do these things.
Yes.
Rather than just walking into a store, a cosmetic store, and requesting to have their skin fixed and all that. But on the other hand, there is a lot of unrealistic expectations being peddled around on social media. So people will come to you with pictures of products that have said they would fix their skin in 2 weeks, 3 weeks. If you can't meet the same standards in quotes, it's almost as if you don't know what you're doing.
Yes.
So apart from the unrealistic expectations from treatments, then unrealistic standards of beauty.
Yes.
There is no skin that is poreless.
Yes.
Skin must have pores.
Yes.
Your pores can be smaller, and we can have products that will make them look slightly smaller, but we can't eradicate the pores.
No, we can't.
So yes, that's what social media has done. Then for the people that are younger children that are very impressionable, that's where I find that it can be a really big problem. Because in my adulthood, I'll just see whatever it is. Oh, she's perfect. I'll slide through and go onto what I'm doing.
Yes.
But for the impressionable child or young adults, they start to, they start to view themselves through those lenses.
True.
And see their imperfections become even more glaring to them.
Yes.
And
self-esteem issues.
Self-esteem issues. The mental health people will tell you how much damage social media does to self-esteem, the
self-image,
and the psyche of those impressionable people,
even older people. I'm finding it's happening in with older people as well. Funny enough, social media must be very, very powerful. You find it also in older people comparing themselves, rushing products that just because they say that's faster or. Do you understand? I'm finding that yes, we're dealing with young people and trying to get them corrected, but we have older people that haven't yet figured out themselves as well.
Yes, I agree with that. It's a strength of self.
Yes. Knowing who you are.
Yes.
And who you are, be confident in you.
I think for the older people, the bigger problem I have is when they come in with those pictures of people that have done fillers and Botox.
Well, trying to stay younger and
yes,
not aging.
Yes. And they want to be taken back to how they looked 20 years ago. That cannot happen, you know?
Yes.
I think that could... So now I don't get as many patients coming with those unrealistic expectations as I used to. I think over time, what goes round about the type of work that you do, and how even if I can do it, I'll discourage you.
Yes,
because some things are just not sustainable. We want you to look like a well-preserved 40-year-old, not to look 20. You can't look 20 anymore, but you can look really good. For your age, and that's what
if you take care of your skin.
Yes, you take care of the skin. You know, just some little tweaks here and there for professional treatments. But you want to change your whole face, and it's not my cup of tea.
So, what do you think about Botox? Because I mean, I don't know how common it is here in Nigeria, but I know in the US they have Botox parties, and because I know they have, so I'm sure they do it here as well.
Yes.
But what's your take on Botox? I don't know why I always feel like, and that's why I'm going to ask you, because I always have this feeling that when you start it, if you stop it, then you're going to have a problem with your face. I don't know.
Okay.
I don't know if I just me imagining when I look at people, I feel like when you start, you have to keep on doing it. Do you understand? I don't know. What's your take?
So, I'll talk about Botox, then I'll talk about dermal fillers.
Okay.
So, what Botox does, cosmetic-wise, in fact, we call it cosmetic Botox, Botox cosmetic.
Yes.
What it does is it relaxes muscles.
Yes.
So, by relaxing the muscle, the skin overlying the muscle doesn't move as much and it looks less wrinkled. That's what Botox does in the cosmetic sense. Botox was first used for cross eye, I think, if I recall. Yes, that was the first use of Botox in the history of use of Botox.
Wow.
So it has many other medical uses. We use it for cross eye, we use it for migraines. I get migraines. Botox for migraines.
Migraines, yes.
It's fantastic. I even forget that I have them. When I start, I only realize my Botox is wearing out when I start to have the migraines. I had a migraine today. I had one yesterday. What's happening? Then I realize, oh, Botox needs to be done. So, for me, it does two things. The cosmetic benefits and then for my migraines as well. Yes. So it has many other benefits other than the cosmetic benefits. So let's look at cosmetics. I think the bad image that it has gotten is mainly from the unregulated use of the products.
Yes.
Especially in Nigeria, we have talked about regulations. They don't really exist.
Yes. Yes.
Everybody can, once you have enough money, you can just open up something, call it a clinic, and you start injecting people.
Yes.
So a lot of the bad outcomes, not to say that we don't have bad outcomes, come from the medical professionals.
Yes.
We can, but a complication is different from negligence.
Yes. Always said a big difference.
Yes. And just working outside your scope.
Yes.
Right? If you do it well, it can have really nice benefits and a nice results.
Yeah.
Now, looking at how, yes, people will say that when you stop the Botox, you can look worse than you looked.
Yes.
In fact, for Botox, what happens is because you're not using that muscle much, it preserves the integrity of the skin overlying that muscle.
Okay.
So if you are having Botox consistently for, say, 3 years, the wrinkling you should have after 3 years will normally not be there because you're not using the muscle.
Okay.
So Botox has a preventive quality to it. It will prevent the wrinkles from happening.
And doesn't make the face over tight, is it?
So it depends on how much Botox is done. I had a lady come to my office. Her face it was almost as if they poured a gallon of Botox on her face. It was just frozen everywhere.
Wow. She must have gone somewhere and they just injected all over her face.
Yes. And
oh my goodness.
It was just so tight. And so those are some of that's more of a negligence.
Yes.
Results. Rather than a complication or an adverse effect. It was just too much Botox. I have patients come into the clinic and people like different things. I don't want to see any lines. Some people want to see some lines. Some people want to have all of their expressions, remain. Our actresses don't want to lose their expressions because, they need it. It's part of their job. Yes. So, and we're able to tweak the treatments accordingly, depending on what each patient wants. Right? So the ability to do that will contribute to the patient either getting good outcomes, depending on what they like, or bad outcomes.
Okay.
And like I said, Botox has a preventive quality to it when it comes to wrinkling. Now, let's look at dermal fillers.
Yes, dermal fillers. Okay.
Botox relaxes muscle. Dermal fillers fill areas where there has been volume loss or you want to have an augmentation done.
Okay.
That's what dermal fillers do. So Botox normally would use on the forehead. There are certain areas on the lower part of the face that we can put the Botox in. For dermal fillers, you find people commonly using them on the cheeks, the nasolabial folds, these lines that run down this way, under the eyes. Some people can put it in the chin, along the jawline to structure the face or structure the lower face. So, because of that, what happens is each year, depending on type of filler, if you do your filler after a year, 2 years, you have a top-up. After another year, 2 years, you have a top-up. What you're doing is masking the aging process.
Wow.
So as we get older, we lose fat in some areas of the face. We lose muscle in some areas of the face. You have bone resorption or bone loss in some areas of the face, while bone is being gained in some areas of the face. And what this cumulatively manifests as when you look at the skin is this volume loss is deep here, gash here.
Yes. So looking wrinkled more or less.
So not
necessarily wrinkles?
Not fine wrinkling.
Okay.
Fine wrinkling is what you use Botox for. Those will be the lines on the forehead, maybe your crow's feet.
Yes.
But these are more they're manifestations of a loss of volume.
Okay.
What you do about that is you replace the volume if you want to fix that.
With dermal fillers.
With dermal fillers.
Okay.
So if you consistently get the dermal fillers done every year, or every 2 years, or every 3 years, depending on the product, and then you stop. Let's say I have been doing dermal fillers for 5 years and I stop after 5 years. I won't look the way I should look the way I looked 5 years ago. I will look the way I should look
at that point
when I stop the dermal fillers. And aging has happened. Remember that the dermal fillers were not stopping the aging process. They were just masking it.
Yes, yes.
So that's what happens with the dermal fillers. And when people have had them consistently done for a bit and they stop, they now say they look older than where they started from.
Okay.
And no, that's not what happened.
You were still aging.
You were just
regardless of what you were doing. Yes.
And
now you're looking like what you would have looked if you never did it.
Yes.
More or less.
That's it.
Oh, wow. I think that's a good one. So another thing I want, is there any, like, in terms of, like, everything I know is also wellness. So when it comes to the skin, what do you suggest in terms of diet And what is the main thing? I know people talk about water hydration, like you always talk about, but what about diets? Because people say plant-based diet is better for the skin, which I can never do. Actually, I will not lie. I like my meats. Some people believe in fasting, intermittent fasting. People have different things about what makes the skin better with regards to diets and exercise. What's your take on it?
So, you remember when I talked about vitamin C?
Yes.
How fantastic it is for the skin?
Yes.
The antioxidant activity?
Yes.
Your diet should be centered around taking as much foods that have antioxidant properties as possible and limiting as much foods that have pro-inflammatory properties as much as possible. That's what guides me. So if, your processed foods, what happens with what the rest of your body needs to stay healthy? The same thing that your skin needs.
Yes.
So minimal sugar.
I know, that's my weakness.
No, if you have a sweet tooth, sorry.
That's what I'm saying.
Sorry. Because your processed sugars, they're your enemy. Enemy of your skin. The inflammation, there's glycation that happens at the level of collagen from those ready sugars that contribute to aging the skin.
Wow.
Right? Even the breakouts that we have. I have patients that will tell me that when they eat a certain thing, in fact, that they're ready, but because they like it, they'll eat it and then come to Dr. Hilda. But they know that when they eat that thing,
they're going to break out.
Yeah, they're going to break out. So, the advice generally, you don't like plant-based. There should be a balance somewhere.
I know.
But
meat is good. I mean,
I like my meat as well, but plant-based foods, your omega-3 fatty acids, fantastic. So your oily fish and the rest of them are fantastic for your skin. Remember I talked about the oils that we naturally produce?
Yes.
You produce healthier versions of those oils when you eat a lot of those kind of foods. For supplementation, I'll talk about supplements as well. If you're able to eat, there are people that have pristine diets. I'm very jealous of them. You take a good good portion of fruits, good portion of vegetables, very little carbohydrates, or a good enough amount of carbohydrate to give them the energy that they need, and proteins. They have these very colorful plates, with their vegetables, their fruits. Those people might not need the supplementation.
Yes.
But if you have a very busy life, you eat once a day, and then you eat rice with stew or jollof rice with chicken, you know that you're not getting
what you need,
the vitamins and minerals that you need. Another simple guide is, if you're a food lover and it's fine, try to just eat food that is dense in nutrients. And it will still bring you back to your plant-based foods, your vegetables and fruits and all of that. Minimize these other ones. If you think your lifestyle will not allow you at all, then you need the supplements.
And which supplements are you talking about, like the omega-3 and stuff?
Yes. Okay. Omega-3. For females, I like to add evening primrose oil. It just helps to balance your hormones. You notice that.
I use that a lot I give that a lot to my patients for breast pain.
Yes.
That is not, when you know there's no other problem. I find that evening primrose oil helps with all these breast pain problems. So because it helps with the hormones
so it will help you notice that over time it helps with the skin as well.
Wow, okay.
It helps with breakouts. It helps with how luminous the skin looks. It has great benefits for females, evening primrose oil. Vitamin E, because it's antioxidant. Vitamin C, because it's antioxidant. So remember, if you are able to take a lot of antioxidants in your diet, you don't need these
supplements. Yes.
But if you can't, then please. Antioxidants, evening primrose oil, then your fatty acids. That's typically what I would add.
We have a lot of work to do. Because we that we like our food, we have a lot of work to do. You know, we talked about self-esteem and issues. And I remember I told you when I was coming here, I had one of my staff talk about her journey with her acne and how she had that breakout by use and how it affected her self-esteem so much. Even when she was better, she still had a lot of work to do with her self-esteem. How do you work with those issues that you see? Because most clients will come to you, I'm sure you see their shoulders drooping, they're despondent there. So how do you address that?
So fixing the skin is one thing. Working on the psyche of the patient is another thing. As doctors, I think we have a unique place where patients can really confide in you. So sometimes it might not just be because the skin looks bad. It might be that it's affecting the person's relationship, it's affecting their work. If the person needs to be in a type of job where there is a lot of interfacing with customers, you know, it affects that. And so it's a lot of counseling, empathy, like I spoke about earlier, and reassurance, reassuring them it will be okay eventually, you know. And you try to boost the self-esteem as much as possible. Everybody has something that makes them unique, and makes them stand out. So I turn into a mom for my teenage patients. For my older patients, I become a sister. You know, it will be okay. Just give it a little time, and you can see they walk into the office like this, and they're a bit more confident by the time they leave. And I try to. So also we try to have touch points with the patients. You come in, we give you a treatment regimen. We like to see you again and see you again. Because another thing is, if your patient is stressing out a lot, remember that there are stress hormones that will contribute to the acne. You know,
and other things. So you can might as well talk about that stress and the skin.
So you have to find ways to help them through the stressful period. You know, take up some exercise, eat better, you know, you feel better. So we're able to provide some succor in that way and get better results because we connect a bit more emotionally with the patients.
And you just mentioned something about stress, because many people are stressed right now. A lot of stress around the world, and then in Nigeria, there's a stress. And stresses are things that I always tell people that, to be honest, you can't really run away from. You just have to learn how to manage the stress. How does stress affect skin? Because honestly, I believe it does affect skin.
No, it does. It's clear. Scientifically, it's there. Production of excessive quantities of cortisol. If for sustained periods, because we need the stress in fight or flight situations, right? But when you have stress that is sustained for long periods, that's where you have the problem. So that you have a deadline at work, or you know, a child is ill, and those
challenging work environment or home environment,
little bursts of stress are okay, but don't allow the stress to be sustained for a week, a month, 2 months. That's where you would have problems. It would not just be your skin, your state of health generally.
I think as an entrepreneur, your stress is chronic.
That's why I went for yoga this morning.
I know, that was a yoga is important. As an entrepreneur, your stress is chronic.
You find the things that distress you. If it's watching a nice movie, I was telling my husband the other day, I might have been medical school, or I can just not watch a movie without guilt. Like,
you feel like
I have something to do. There are more important things to do. Only recently have I been able to really view it as a relaxation and a timeout, and my brain is not working. No, I'm only watching this movie and that's it. So you have to find things that distress you in that way. Be it exercise, people that like cooking, you know, pottery, just something that is outside, you know, work.
I think mine is this.
Or
I think this is outside the work. Just sit down and chat and learn new things. I think that to me is my break from my reality of seeing, being clinical all the time. Yes.
So everybody has to find that thing. Yes. Everything. As I was leaving my son this morning, as I was leaving home this morning, my son was watching TV. I was tempted to say, "Have you finished your homework?" Then I remembered I'm trying to learn in my adulthood how to distress, So that's it. Just find things.
Because stress will affect even the skin that you're trying to preserve, more or less. We had a really great conversation. I know I covered a lot with my questions, but do you have anything that you want to share with women everywhere about not only skincare, and you're also wider than that? Is there anything you want to share to our women that you feel has been an issue or they need to learn regarding skincare?
So, regarding skin
or anything else,
please, again, the opportunity wasn't there for me to say this in the course of the conversation, but lighter skin is not better skin.
Yes.
Right?
That's an important point.
Because of social media as well, and,
Yes.
I think it's getting a bit better now because there is this, people embracing their melanin, embracing their natural hair and all of that in recent times. But we still have we still have people coming with this, I want to lighten my skin, I tell them I don't provide that service, but lighter skin is not better skin. If you take care of your own skin, it would look fantastic, and that skin would actually carry you to your later years and the whole of your life on earth. And I cannot have Dr. Chito's skin. Dr. Chito cannot have my skin.
Yes.
You can have your own best skin, and I can have my own best or the best version of my skin as well, if I treat it well. And that's
important. My daughter came up to me and said to me, and she's your complexion as well, and she came up to me and she said to me, "Mommy, why did God give you caramel, give my brother caramel, and give me cocoa?" I almost fainted. I was like, huh?
She must have heard it somewhere.
And I looked at her and I said, because you are the most beautiful cocoa. Because that's how you're Black beauty. And, I've always admired darker the melanin, I always say it. That's why I married a dark guy. So I told her, and you're gonna crack last. You know what I mean? You have more melanin, you're beautiful. And that's how, and then one of the things I said that because I don't want to ever have the notion of changing that color.
Yes.
This color is what makes you beautiful. And the moment you change it, you're gonna upset that beauty. So this is your beauty point, and all that. But it was so interesting that she's only 8 and she's asking me that question to show you how early these kids are being exposed to this concept that maybe lighter is better. Yes. And having to make sure that I said, no. Being that she also, she's Nigeria, also goes to the US, I have to make sure that, look, you are beautiful the way you are. And I think that's a very important message, that lighter is not better skin.
So we have, as parents, the child's self-esteem is tied a lot to what you tell them.
Yes.
When they're younger.
Yes.
Because once they start getting to 13, 14, it's what they hear out there.
Yes.
But if you have planted the seed already, my boys are dark. My younger, of course, they'll be dark. My younger son is even darker because he's playing football almost every day of the week.
Yes.
So he's out in the sun. And, I know when someone has said to him in school has said something about his dark skin, because he will ask me funny questions about sun protection. I'm like, if you can use the sun protection, it's fine. We have them,
Yes.
But I gas him up so much. I've asked him several times, has he heard them describe any man as tall, light, and handsome? It's tall,
dark, and handsome. So I married a dark guy.
It's tall, dark, and handsome. So,
no pun intended to the light one.
I gas him up so much. Yes. His self-esteem, I think it's difficult for you to dent it as of right now.
Yes.
So it's continuing with that. We have a special place where we can do that for our children.
Yes.
That when they get to a place where people are telling them some of the things that can put a dent in their self-esteem, and
True.
they don't allow it.
Yes, very important. Very, very important. This has been a lovely conversation. And that brings us to the end of another enlightening episode of HerCast. A huge thank you to Dr. Hilda for sharing her invaluable insights and expertise on navigating skincare through all the stages of our lives. We hope you've gained practical tips, I have, and inspiration to embrace your unique beauty, whether you're facing breakouts or celebrating the wisdom that comes with aging. Now, if you have more skincare questions or you want more, consultations on your skin, reach out at Skin 101 Clinics, and then that's their IG page. Remember, this podcast and TV show are dedicated to lending women a voice, empowering them with knowledge, and creating a support network that encourages boldness in following their dreams. HerCast with Dr. Chito is a movement fueled by the strong belief that gender equity will transform the world. Watch our full episodes on YouTube at HerCast with Dr. Chito. Listen to episodes on your favorite podcast platforms and follow us on IG at HerCast Podcast and at Dr. Chito N. You can also send questions at Tabitha Medical Center. Guess what? We're also on Rapid TV, channel 176 on Star Times every Saturday at 7 p.m. and Sunday at 2 p.m. Until next time, keep glowing and embracing every age with confidence. Thank you for joining us today on HerCast, where we empower women to shine inside and out.